Hi everyone, Dr. Nemechek here. First, I would like to remind everybody we need you to hit that subscribe button to grow our viewers. We're trying to hit 30,000. The more viewers we have, the more likely our material will be shown to parents, especially parents with children with autism. We need to get higher rankings in that algorithm, and your subscribing is the one way we're going to do it. This is a new feature this week we're going to try out. I'm going to read off some of the questions I got from our viewers who left and just review these for everybody. If you have questions, put them in the comment section. I'll answer them there, and then I will also answer them once a week on this format, for lack of a better word. So first we got one. Somebody asked a question, is an arachnoid cyst the result of inflammation? Now, your brain and your spinal cord are covered by a sac of tissue called the meninges, all right? And an arachnoid cyst is when you get a cyst in that space. Now, we know sometimes these can develop at birth, and then they can also develop later on in life. I have found that these are highly sensitive to as the result of inflammation, because when you lower inflammation, they'll go away. I've had a number of patients, these are mainly adults, large cysts, we might have to have surgery, is it causing some symptoms, and we put them on the protocol, and within a few to several months, they'll do an MRI scan, and it's either completely vanished or it's dramatically reduced by lowering inflammation. So yes, I think in many cases this is due to inflammation. Now they'll say in the research, sometimes they'll say they don't see evidence of inflammation. What they're saying is they don't see evidence of white blood cells there. Now, the kind of inflammation we're talking about is metabolic inflammation, of which inflammation is not present. These white blood cells are not present. It's from the chemicals released by white blood cells that are causing this. So yes, I think arachnoid cysts are from inflammation and can reverse with the protocol. Another writer a viewer is saying, can I take creatine while doing the Nemechek protocol to help me with my Asperger's? I'm 28 years old. Are all supplements banned on the protocol? No, all supplements are not banned on the protocol. I don't want people taking a lot of supplements because in general they're doing it just in case. There isn't really a specific need for it. And there's a high rate of fraud, up towards 80%. So we don't even know really what's in there. But in general, yes, you can take creatine. You might be doing it for bodybuilding or something like that. I don't know why, but that would not get in the way of the protocol. Another is, as an adult with possible SIBO and autonomic nervous system type symptoms, my head hurts, my back hurts, I have cervical instability. What are the negatives or problems with taking rifaximin 10 days a month or so, maybe for many years? Well, one, if you are doing the protocol, most people don't have to take it many years. Most people, if they're needing just monthly because they're relapsing, they don't need to take it for many years. They'll get to a point where they might even need it once or twice in a year. I have some people, they only need it once every couple years after they recover. So it's very, very unlikely you need to do it for a long term. But even if you did, we have been using continuous, meaning twice a day, every day rifaximin for a couple decades successfully in patients with advanced liver disease, and they tolerate it just fine. We don't see any long-term risks with it. So it's a very safe medicine, but in general, most people don't have to do it forever. Okay? Another question. My gut is now good after following the protocol, but my anxiety issues are still persisting. So I went to a nearby psychiatric clinic. My blood pressure was elevated, and they prescribed me some propranolol, which is a beta blocker, and escitalopram, which is a serotonin drug called Lexapro. What should I do? Should I use these medicines or not? Because people say once you start these medicines, you can never get off. Well, there's a lot of things that people will say, like once you start these medicines, you can never get off, because they aren't really addressing the primary problem that's causing it. Okay, they're really just Band-Aids. Now, I'm not against Band-Aids, because they can help you a great deal. They can alleviate a lot of just symptoms. But the key is getting the inflammation down. So even though this person's feeling better, they may need, maybe this is an adult, I believe, they might just be using inulin, which can help some of your GI symptoms, but can't lower the inflammation enough to get your blood pressure system to recover. Most anxiety is from low blood. Once you balance the gut, most anxiety is from low blood pressure in the brain, which is damage from the autonomic nervous system and requires a sustained suppression of inflammation, which unfortunately doesn't work with inulin in adults. You need to get some rifaximin. And so I think that's the answer here, and that they'll find that once the gut is balanced and they start recovering a bit more. Now, they also need the fish oil and olive oil, the other components of the protocol. But once they start recovering more, they'll be able to get off propranolol and the citalopram. Here's another question. Is foot tapping the same as toe walking? So in kids, toe walking, where they're on their toes, is a way to kind of contract the muscles and blood vessels in the legs, and it generates blood pressure in their brain and alleviates the low blood pressure issue they have. And now in adults or teenagers, when they're sitting, the muscle movement, tapping, when you see these people really tapping a lot, that's generating blood pressure to their head. So in a way, they're different, but they are achieving the same effect. They're alleviating the low blood pressure in the brain from autonomic nervous system damage. And again, the protocol will help reverse that, so that is not necessary. And last question is, are drusen reversible? Drusen are these little white spots that your ophthalmologist can see on your retina, okay? My entire medical career, they're like, oh, they're just a little something, we don't think they're important. We now know the drusen and the retina are same as plaques that you see in Alzheimer's. Yep. And that as you increase drusen in your retina, which can be seen by an ophthalmology scan, it's increasing your risk of developing Alzheimer's. It's the same disease process. All right? Question is, are these reversible? Absolutely. We've had several people, they actually go to an ophthalmologist in Laguna Beach, California, called Alicia Harrison, and getting an eye exam there is like going to NASA. It's awesome. But she will track your drusen for you. People will go once or twice a year, and she will help put people on our protocol. And when you see those reverse, you know your brain is getting healthier. So I hope you like this feature. Again, leave some questions if you have them, and we'll answer those next week. And everybody, take care of yourself, take care of your kids, keep your inflammation down. Have a good one. Take care. Bye.